So maybe a friend mentioned she started a weight loss medication and felt amazing. And maybe you've scrolled past a dozen ads promising you'll finally get your body back with one weekly injection. And somewhere in there, you've probably asked yourself the same question a lot of my patients ask me. Do I need this? Or am I supposed to try harder on my own? So that's what we're going to be talking about today. Hi, I'm Dr. Lola Ashaye. I'm a family medicine physician and founder of InTouch Primary Care in Sugar Land, Texas. And I specialize in primary care, preventative care, and menopause care. I help both men and women finally get real answers about what's happening in their bodies. So let's get into it. So in the last episode, we talked about why our metabolism genuinely changes in midlife, not from lack of effort, but from real shifts in hormones, in muscle, in insulin sensitivity. So the natural next question is, does that mean medication is the fix? Well, let's talk about it. So this is something I see, right? A woman in her 50s, maybe wondering about weight loss medication, and she has friends on GLP-1s that swear by it. And part of her feels curious, but another part feels like reaching for a prescription will mean that she's admitting defeat. So she found a website, and they're going to prescribe the medication after a 5-minute questionnaire. She added the medication to her cart, and then she decided to close the tab. She never filled it. She just didn't feel right about it, and she didn't know what questions she was supposed to be asking. And so because of that, she just, stopped. So we're going to talk about that today. And these medications, like GLP-1s, are genuinely effective for a real biological reason. GLP-1 medications work on appetite, blood sugar regulation, and clinical trials have shown substantial average weight loss compared to placebo. So it's not a fat claim. The thing about it is midlife bodies respond differently than the trial average. Women in perimenopause and menopause may find that GLP-1 side effects like nausea, appetite changes, and fatigue overlap with symptoms they are already experiencing from the hormone transition, which can make these medications harder to manage and side effects harder to sort out. So without a deliberate plan around protein intake, resistance training, and a real portion of what's lost on this medication can actually be muscle, not just fat, which works against them long term, especially when you're already losing muscle from the hormone shifts we covered in the last episode. The other thing about it is timing and dosing matter more than people realize. A slow, careful titration and sometimes planned pauses tend to be better tolerated in midlife than the standard escalation schedule. But that's a judgment call that needs a doctor watching your response, not a fixed protocol from a quiz. These medications may interact with things that you're already taking. So GLP-1 slow how quickly the stomach empties, which can temporarily change how your body absorbs other oral medications, including potentially oral hormone therapy. So a systematic review found that the overall drug exposure generally isn't affected enough to require dose changes for most medications. But there's at least one published case of a woman whose menopause symptoms worsened during semaglutide titration, likely from temporarily reduced estrogen absorption, which resolved once the titration was resolved. The other thing to consider is, if you are on oral hormone therapy, you want to have this conversation with your prescriber. Also, combining the right therapies done thoughtfully may work better than either one. So early retrospective studies showed that postmenopausal women on both GLP-1 and hormone therapy lost meaningful more weight than those on GLP-1 alone. So 16% versus 12% at 1 year. So this is promising, but we need larger studies to confirm it. And that's exactly the kind of finding that shows why this decision benefits from one doctor who can see a whole picture, not two prescriptions from two sources that never talk to each other. So if you know a friend currently on one of these medications or thinking about it without a doctor really walking her through it, send this to her. Getting the right treatment matters more than getting it fast. So you may have heard, isn't taking medication just an easy way out? Well, needing a tool to work with your biology isn't a moral failing. You didn't take a shortcut to develop insulin resistance or declining estrogen. Your body did that on its own. So using an appropriate, well-monitored medical tool to work with your physiology isn't cheating, it's medicine. But some might say, I don't want medication, I'll rather do this myself. And that's completely reasonable. For some, that's the right answer. After a real workup, nutrition, strength training, sleep, and time, that could be all that a person needs. Medication is a tool for some people in some circumstances, but it's not mandatory. That decision should follow an actual evaluation, though, not just guesswork. What if you're feeling, I'm already losing muscle? Wouldn't this make it worse? Well, it can if it's approached carelessly. And that's exactly why muscle preservation, protein, and resistant training has to be part of the plan from day one if a GLP-1 is the right call for you, not an afterthought once you've already lost strength. And then you may think, well, I can just get this easily from a quiz. Well, you can, and that's the part that actually worries me. A 5-minute questionnaire can't see your full history, your current medications, or whether hormone therapy is part of your picture. Starting is the easy part. Doing it safely with the right monitoring is the part that needs an actual physician relationship. So here's what I want to leave you with. Whether or not medication belongs in your plan isn't a question a quiz can answer. It's a question that deserves an actual conversation with someone who can see your labs, your history, and everything else you're taking. And that's exactly the kind of visit we have here at InTouch Primary Care. It's built around unhurried appointments, direct access to a doctor between visits, and honest individualized conversations about whether medication fits your picture. Many common medications are included with our membership, and those that aren't are available at wholesale pricing alongside wholesale pricing on labs. So you're getting an honest answer, not a sales pitch. So I'm licensed in several states, so much of this can happen by telehealth. So if you're wondering whether you need this, let's find out together. You can book a free 15-minute consult at intouchprimarycare.com. The link is in the description. So remember, this video is general education, not medical advice, except I'm your doctor. And I hope this helps. But imagine making this decision with someone who actually knows your full history, not just a 5-minute quiz. Imagine feeling confident in your plan, whichever direction it goes, because it was built around your real body, not a generic protocol. Imagine getting real support either way. That clarity is available to you. So if that's something that you think you need, well, keep listening, and I'll see you in the next one.